Working with families is integral to community health nursing practice. In keeping with the notion that building healthy families builds healthy communities, which in turn builds healthy populations, a community health nurse's focus on families is both warranted and indeed crucial. This video program focuses on family assessment within the context of community health nursing practice. In the video, frontline community health nurses will illustrate the process and issues inherent in assessing families. First of all, though, what is a family? This is not an easy question to answer in today's world, where family forms can be quite diverse. Families can range from the traditional nuclear family to blended families, single-parent families, same-gender families, and so on. Perhaps the most valid definition of family may come from the families themselves. Who do they see as comprising their family? If they include extended family, an international student who is residing with the family, a friend who lives with them in their home as family, then it is these people that the nurse should focus on. So, one of the first questions a community health nurse needs to ask when assessing a family is, who do you consider to be your family? The definition of family by Wall captures this perspective of family. The family is a self-identified group of two or more individuals whose association is characterized by special terms, who may or may not be related by bloodlines or law, but who function in such a way that they consider themselves to be a family. Now that we have looked at who is being assessed, how can family assessment be described? In essence, it is gaining insight into the family's world, their goals, their needs, their concerns, their strengths, their support networks, and so on. In other words, gaining a holistic view of the family and its environment. What are some defining features of family assessment within the context of community health nursing?
I think one of the most unique aspects of community health nursing is the home visiting. By going to these families' homes, we are able to more thoroughly assess their physical environments. As well, families are often more secure and comfortable in their home environments, so they're more likely to be more open and express their views and opinions. So I think it allows for a more thorough assessment.
In this role of public health nursing, we get to see new families from like day 3 pretty much right up until 18 months in child health clinics. So we get to build a nice relationship for that whole time. And also, if they're followed under another one of our programs, the Long-Term Healthy Beginnings program, we're able to follow them from birth till age 5. So you really get to know the families, you get to build a relationship, parents feel that they can call you with questions and concerns. I think that's unique to community health nursing. I don't think you get the same long-term relationship in other areas.
As you can see, community health nurses have some distinct advantages in assessing families. For example, the nurse's ongoing contact with a family promotes trust and the development of a therapeutic relationship, both of which are foundational for effective assessment. This ongoing contact also allows for assessment to continue over a period of time. Furthermore, although the nurse can do family assessment in the clinic setting, she often visits families in their own homes. Not only are families likely to be more comfortable and therefore more open in their own environment, but also more family members are likely to be present, which then allows the nurse to focus not just on 1 or 2 family members, but upon the whole family. Why is this important?
It's very important to look at the whole family and not just the one piece, so you can get a broad understanding of the whole family. If you just look at one part, I feel that you will probably miss quite a few things that will be important to know.
There are some situations, of course, which does make it difficult to do an assessment on all family members. For example, if a family, the mother and father are separated or divorced. Also, if one of the parents are working away, which is a very common occurrence in this province right now. So when you go to the home to do a visit, you may just have a mom, child, and a sibling, so you're not able to assess the family as a whole.
Oftentimes, the older siblings may be perhaps in school, that you can, assess the the sibling connection. And oftentimes through child youth and family service, the child may be apprehended from the home and is placed in foster care.
I worked with a family from a foreign country, and the mom was here attending university and trying to do her master's, and then she ended up having a baby. No other family around, not a single person that she could rely on, and the dad was also in another country working and couldn't even be there for the birth of the child or for the first 2 months of the child's life. So for me at that time, the family unit was just the mom and the child, and that's what I based my assessment on.
There are several family assessment models a nurse can use to guide her assessment. For example, the McGill model, the Friedman Family Assessment Model, and the Calgary Assessment Model. No individual model can capture fully all of the dimensions of a family's experience, and each model has its particular strengths and weaknesses when considering the context of assessing families in community health nursing practice. However, such assessment models can be invaluable in providing guidelines for areas to focus on in assessment. The nurse can also use such tools as genograms, which create a pictorial view of the family structure, relationships, medical and social history, and boundaries. Ecomaps, which give a pictorial view of the family's connections with entities beyond itself, can also be helpful. No matter what model or tool the nurse may use, it is important to approach the assessment not as something to be done to the family, but as something to be done with the family. In other words, seeing the family as an active partner in the process of assessment, with the nurse facilitating the process. In this sense, the family is not only seen as the targeted client, but more importantly, as a partner with the nurse. Having a partnership stance is, I think, critical to effective assessment.
When considering the family as a partner with a community health nurse, I think it is important to use open-ended communication techniques, definitely allowing the family to answer the questions quite openly, as opposed to using closed-ended questions or just a checklist. Sometimes, families are in crisis. They don't always, recognize their strengths. So I think a good example of partnering is working with these families to help them explore and identify the strengths they need to go on and help them deal with any stresses or crises they have ongoing in their lives right now. An example that I can provide is, when I was involved in a family, both parents had mental health issues, had just had a newborn baby and a 4-year-old as well. A big adjustment for this family, and with the mom not working full-time and only getting about 55% of her salary, of course there was a lot of financial stress. So a lot of issues affecting both parents' mental health at that time. So mom, to try to deal with the financial difficulties, decided to return to work, a night shift being a more suitable time for her. However, mom doesn't have her license, so then transportation became an issue. And dad wasn't able to give her a ride to work just because it's time that the children would be in bed. So it was a major crisis for this family at that time. And as I said, when they are in a form of crisis, sometimes they're not always able to recognize their strengths. So as a public health nurse, you're able to partner with these families to help them identify strengths such as family supports. Who do they have that they can rely on to provide some transportation to this mom so she is able to return to work?
Note in these comments that part of the partnership between the nurse and the family is focused on identifying strengths. If the nurse focuses only on identifying problems and needs, then the assessment will not be holistic, and valuable resources for the family can be missed. The nurse who approaches family assessment from an assets viewpoint